It is one of the world's biggest health problems, back pain. And if you're living with it, you know it can greatly affect your quality of life. So today, Dr. Todd is here. He's an orthopedic surgeon with OrthoNeuro to tell us how to handle it and really when to seek help. And doctor, you kind of said, I'm nobody's best friend, so I don't want to have to give people, the bad news, because it is something that greatly affects their lives, though.
That is correct, Robin, and thank you for having me. No one ever comes in and high fives me and said, it's great to see you, Dr. Todd. I'd love to see a spine surgeon. So no one ever wants to come see me, but unfortunately it's very common.
It is very common. So let's talk numbers. How many people are out there suffering with low back pain?
Millions and millions. It's actually, in fact, second only to the common cold taking people to a physician. So wow. 8 out of 10 people at some point in their life will suffer from disabling low back pain that then affects their quality of life enough that they have to miss work, days of work, with billions lost in lost revenue each and every year.
What are some of the most common causes?
The most common cause is typically a back sprain or strain, muscular discomfort that may take you out of your job and or daily activities for a day or two is the most common.
And the thing is, I feel like, I was telling you, my husband who's young has low back pain. It's not always something that happens when you're older. I mean, it's something that anybody can have happen to them in their lives.
Absolutely. We see at OrthoNeuro, we see patients from 14 years old to 80 to 90 years of age. So it can affect all cross sections of life, male, female. It really does not discriminate.
Are there often warning signs, or is this something that happens suddenly? Because as you mentioned, some of the sprains and strains, it also, there's discs in there, there's, different issues that can happen.
You bet. And in fact, there are a lot of family doctors out there, ER physicians, who don't feel comfortable treating patients with low back pain because of the multitude of reasons patients can have back pain, from aortic aneurysms to ovarian cysts to bad degenerative disc disease to herniated discs to multitude of things. So a lot of times they will send us over and we open our doors at OrthoNeuro to say, listen, this is what we do. We see thousands of patients each and every month. Please send them over. This is what we do, and we'll sort it out for them.
How do you know then if the pain is something that will go away on its own, or if this is something you really need to seek help about?
You bet. So the warning signs and symptoms that would get more of our attention as a spine specialist would be more of a sciatica type of pain, a radiculopathy, maybe that pain that starts in the back and shoots down the leg. That tells us that there is something pinching on the spinal canal, and that may warrant further physical therapy interventions such as spinal injections and or an MRI to define what is going on. So it's warning signs of neurologic weakness. Obviously any trauma of a fall should take you to your physician, but bowel or bladder dysfunction, we ask things like that because of issues in the spine can cause urinary dysfunction, night sweats, fever, chills, a dull ache that just won't go away, that you should probably go see your primary care physician.
It's interesting. I mean, your back it's a big portion of your body, so it's amazing how many areas that it can really impact. Surgery is obviously a last resort, but it is needed sometimes.
You bet. And so I tell my patients that typically 98% of the patients who come through my door do not need surgery. It's whether I'm surrounded at OrthoNeuro by great physical therapists. I've got a physician who specializes in injections, massage. There's chiropractors out there that do great work. So there's such a multitude of things that can help patients get over this pain. But when it does come to surgery, I'm blessed to have 6 spine surgeons under our roof at OrthoNeuro that specialize not only in the ortho side of the spine, but also the neuro side of the spine. So we cover really all the whole gamut of scoliosis to herniated discs. And when applicable, we do offer surgery. And we have advanced so far over the last decade. I'm an old man. I've been out for close to 20 years now. And I've seen it go to now we're doing surgeries that we never would have thought of doing on an outpatient basis, that patients are getting back to their quality of life sooner, much sooner.
And I think that's very great to mention, because a lot of people are nervous when you say the word back surgery, but to know we have come so far, our rate's pretty successful.
You bet, you bet. And again, just being over the last, it seems like we were late to the show in the spine world, hand, foot and ankle, hips, we're getting great results with total hips, total knees. And now spine, we're finally getting to the artificial disc replacements. We're getting to the, minimally invasive outpatient surgeries that are getting patients back quicker to their life and quality of life.
All right, that is always good stuff to know. So Dr. Todd with OrthoNeuro here. And you you can call them to make an appointment if you have any questions about your own issues. So thank you so much.
Thank you.